All right, the next item on our agenda is an update about the Alamance County criminal justice system. And I had asked for this item to be put on the agenda because we've had a lot of concern in recent months from the community about interactions between the public and law enforcement officers. And some of the concerns that have been raised are things that have been worked on for quite some time in Alamance County. There's initiatives in other parts of the country to have mental health professionals to respond when the officers are called out, and Alamance County has been working on that in a program called the Stepping Up Initiative and the construction of a diversion center related to those things. That's been going on for a while. We also have a pretrial assessment program that Alamance County has been putting a lot of effort and energy into. And then there have been questions raised of the sheriff about his training, how he trains his officer, and there have been requests for policy reviews from different members of the community. So we're given these initiatives, these programs, the floor today so that public can be better aware and better informed about what's really going on. So I just want to make it crystal clear that the sheriff does not report to this board. The Alamance County Board of Commissioners, no Board of Commissioners in North Carolina is a supervisor of a sheriff's department. He is an independently elected official, and he alone is responsible for the policies and procedures of his department. We do allocate a dollar amount for his budget, but he is at liberty to use the money, in whatever way that he sees fit. It's the same kind of thing we have with the school system. We set the school system's allocation from the county funds, and then the school board decides how they're going to do it. Just like the school board is an independently elected authority, and we don't dictate or boss around or tell the school system how to operate the schools. We don't dictate, boss around, or tell the sheriff how to run his department either. But that being said, we do work closely with the sheriff and try very hard to support him and make sure that he has the resources that he needs. And we want to give him the opportunity, and others who've been working on these initiatives, the opportunity to tell the public more about what's been going on in the area of criminal justice reform in Alamance County for the past 5 years or so, or more. So I think first we're going to hear about the Stepping Up program, and Linda Allison.
Thank you, Commissioner Gailey, and good morning.
Good morning.
Good to see you all. We are privileged in Alamance County to have a Stepping Up initiative. Our initiative in Alamance County actually began by this board again in 2015. A resolution was passed to make Alamance County a Stepping Up initiative county. The work began shortly after that, I'd say early 2016. Nationally, just so you'll know how large this movement is, there are about 544 counties nationally that participate in Stepping Up. This is a partnership between the National Association of Counties, the American Psychiatric Association, as well as the Council of State Governments. In North Carolina, there are 47 counties currently that have signed on, and I want to think that we were one of the original 10. Our work began very early on. In Alamance County, we're actually working with 30 or more organizations as part of this Stepping Up initiative. So it is not only a sheriff's office initiative, but as well, it is a community initiative. The Alamance County Stepping Up initiative is housed in the sheriff's office and supported by the sheriff's office greatly, with advisory oversight from the Justice Advisory Council. You all know about the Justice Advisory Council. You actually approved the Justice Advisory Council when it was created in 2017, and that is a commissioner-appointed board. There is a list of some of the voting members, actually most all voting members of the Criminal Justice Advisory Committee that we call our Justice Advisory Council. So again, we work for the sheriff, and this initiative is out of the sheriff's office with advisory oversight by the Justice Advisory Council. As I said earlier, we have been very purposeful since the very beginning to make this a community issue. It is a community issue. We wanted to make it a community initiative, and so we have created from the very beginning an avenue for the wider community to participate in this. In September of 2016, we had a 2-day dialogue that was held with over 75, I believe this is actually a picture from that. I see Chris Burdick in there, so it's been a while. This was September 2016 when we had a 2-day dialogue, and we had over 75 county participants included, and we took information from them about the criminal justice system overall in Alamance County, where the gaps were, where the needs were, and that was a very successful 2 days. And from that, we formed committees for the Stepping Up Initiative, about 4 committees that started working on things like training. They started working on doing work within detention center to improve services to mentally ill and lots of other things. I'm happy to say we actually followed up 3 years later with another community initiative that we held in October of last year. It was called a sequential intercept mapping process. There have only been about 4 or 5 counties across the state that have done that. It's a national model, and we were one of those counties. So I'm really excited. But just as a reminder, the 4 national Stepping Up goals are simple. They're to reduce the number of mentally ill that are booked into jail, to shorten the time that they spend in jail as far as jail days go, to increase the connection to services, and to reduce jail recidivism. And that is, in a nutshell, again, what this initiative does. And we are working in all 4 of those areas. I won't belabor it today, but just if you have specific questions, we've done lots and lots of work there. I'm just going to hit some highlights today. This is a statement that was in the 2017 report by North Carolina Disability Rights in North Carolina. It says a number of law enforcement agencies have recognized the dire need for mental health and substance use disorder services in local detention centers. Some county and state officials have made efforts to improve mental health services in their jails, including implementing Stepping Up programs, creating behavioral health units, and instituting pilot programs for providing substance use treatment in jail. These programs highlight the need for statewide action to improve mental health and substance use disorder treatment in North Carolina jails, and illustrate that such programs can be affordable and effectively implemented. I'm happy to say that we've done all those things in the Alamance County Detention Center, or are in the process of working on those. And the other thing I would want to say, actually go back to that, Sheriff Johnson started his, sounded his alarm more than 20 years ago, I would say. He came out when we still had a mental health system actually in place in Alamance County. He raised an alarm about the numbers of mentally ill who are being housed in the jail. And quite alarming is that some jails in the nation actually house more mentally ill than the largest state hospital in their state. So it's quite an alarm. Some of the highlights of what we have done over the last year, I'm happy to say more than 200 law enforcement officers, including some of our detention staff and officers, and more than 20 EMS staff have been trained in the Crisis Intervention Team training, CIT trained, and to respond to mental health crises. When Stepping Up was formed, we went to all of our law enforcement chiefs as well as our sheriff, and we said we have to set a benchmark. What would you say? Would you say 20%? You want 20% of your workforce to be trained in Crisis Intervention Team training? That's a 40-hour training. And they said, no, we want 100% of our officers on the street to be trained. So what that meant for us as a Stepping Up initiative, we met with Cardinal Innovations and we decided we needed to have more trainings. At the time, there were 2 being offered per year in the county and 1 in, I think, Hillsborough, Orange County. And so now we're having 5 different trainings throughout the year. Needless to say, 2020 has been a different year. 3 of those trainings have already been canceled for this year, but we're hopeful that towards the end of the year we'll be able to make up some of that ground. More than 800 community professionals and stakeholders, including court staff, school personnel, county staff, and others have been trained in mental health first aid as a direct result of our initiative to increase both CIT and mental health first aid training. Mental health first aid training, many of you maybe have participated. It's only an 8-hour training and it's for community professionals. We have added some certified trainers. They have to go away and be certified in a week-long school, and the county, through the Stepping Up Initiative, invested in paying for some of that training. So we have 4 to 5 certified trainers. Some of the other highlights of our initiative, just to name a few, positions supported by the Alamance County Sheriff's Office. We have 2 sworn officers, a sergeant and a corporal, who, back to Commissioner Galey's comment about co-responders, mental health co-responders, they basically are a team of CIT skilled officers, and they basically are out in the field handling primarily mental health calls. And that, I'll tell you a little bit more about that in just a minute, but that has proven quite successful. Burlington Police has what's called a co-responder model, where they pair a mental health professional with a police officer and go out in the field together. That's the model they're using, and that one works quite well. A clinical social worker was added in our jail. The sheriff graciously agreed to take 2 of, at the time, vacant jailer positions and reclassified that into a licensed clinical social worker in detention, which was critically needed. So this person works for early identification of mental illness, screening and treatment, as well as re-entry planning. We want to make sure if they're in the jail today, we can do everything we can do to make sure they stay on their meds and they're not going to return to jail. You're going to hear a little bit more from Steve Ginter in just a little bit, but as part of our Stepping Up initiative, we did have funding to run a 12-month pilot project of a pretrial release or pretrial supervision program. That was to divert low-level mentally ill offenders from jail to treatment. If they sit in jail and spend 21 days for time served for a crime, they're probably not getting a lot of treatment. But if they can spend 1 or 2 days and then we can get them out under supervision for 2 or 3 months, and they can basically comply with their treatment program, then there's a greater likelihood they're not going to return. Coordination with county planning team, as Commissioner Galey again referenced, you all know about the 24/7 Diversion and Restoration Center, Mental Health Crisis Center that we have planned. You all graciously agreed a few years ago to dedicate the building at 1946 Martin Street for this purpose. Cardinal Innovations donated in early 2018 $1.2 million in funding to renovate that building. We are anxiously awaiting the day that we can do that. We also have worked with RHA Healthcare, which is the contracted crisis provider of mental health services, to expand their hours currently to weekends. And so that is something that's quite exciting for us. Additional, again, I'm not going to hit everything we've done, just the highlights. I mentioned earlier how critically important the crisis intervention team training was for this community. And we identified early on that we needed to have our own local steering committee for crisis intervention team training. We did not currently, when we started Stepping Up, have a local one. That we had people who were participating in the regional one, I believe in Orange. But we now have a law enforcement run crisis intervention team training steering committee. And that has greatly strengthened this program. They meet after every training to say what worked, what didn't work, what do we need to change, what are we doing, for our officers, what needs to change. And so that's been very well. Again, we added a pretrial services supervision committee and put that in place to plan for this program, this pilot that we wanted to do. That committee started meeting in August of 2018. And that included all of our judges, the DA, defense attorney, sheriff, commissioner, our detention captain, and lots of people working locally to revise some of our criminal justice system elements. Formation of the Justice Advisory Council, we've already talked about that. That basically merged the Family Justice Center Advisory Board and the Stepping Up Leadership Team into one, and that was in 2017. We have enhanced data tracking, not only in the sheriff's office, but we're collecting data from across the county for CIT training of officers. So that's been a direct result of stepping up, that we're tracking and monitoring some of our data with regard to mentally ill in jail and services across the community. We have applied for a 2020 Bureau of Justice grant, the grant that I have been employed under, and this work that we're talking about actually is closing out. That was a 3-year grant, and we got a partial year, no cost extension. But we applied for another grant that actually, if we received that from the Bureau of Justice, that would work to expand the crisis center hours at RHA Crisis. Right now, they've just expanded from 8 p.m. every day. They've expanded to weekend hours as well. Before, we had no weekend hours. They're now open from 8 a.m. to 8 p.m. on weekends, and this would expand it, we hope, to include up to midnight. We're getting closer, ever closer to that 24-hour diversion center. We also would be adding what's called a peer support specialist in the detention center under contract. That would be a contract position, and that person would work directly with mentally ill and or mentally ill substance users who are leaving jail to make sure they stay in treatment and that they are able to get the appropriate housing and services that they need, so they don't go back on the street into the same environment they came from. I spoke earlier about the sheriff's office having two sworn officers, a sergeant and a corporal position, that do crisis intervention team response to mental health calls. In a 3-month period alone, I think this is 123 calls that they responded to. Of those, 78 of those were resolved on the scene, meaning they took care of it themselves. Another 14 of those were voluntarily transported to a facility like RHA or somewhere. 31% of those were involuntarily committed and appropriately transported there. And in this particular 3-month period of 2019, there were no arrests.
Excellent.
Yes.
That's great.
These are mental health calls, and this is our crisis response team in the sheriff's office. Not even data from across the county, but just our sheriff's office. And the sheriff may say more about that later. I think over a 9-month period, to give you another example, 55% of those over a 9-month period were resolved on the scene, meaning nothing further was required. They were referred to treatment and that kind of thing. As I said, we are tracking data. When we came in and began stepping up, we didn't even have a baseline. We knew we had a lot of mentally ill in jail, but we did not know how many. And so we started working really hard with our IT staff and others to put systems in place, and the sheriff graciously agreed to purchase a software program for us at little expense, but it helped us to be able to track that data. It was called Crystal Report. So for last year, our mental health screen positive rates, that means out of all the inmates in a jail in these particular months, this is 2020, but compared to last year. So for 2020, our screen positive rate thus far is 21%. It's down. Obviously, our jail population overall has been down during COVID. But compared to last year, we're now sitting on about a 30% average for 2020 after 2 quarters, as compared to last year was 36%. But if you look at the 2019 average, basically you can understand what our officers are dealing with in detention. We're basically talking about, almost more than a third of our inmates having mental illness, and that just again escalates the level of intervention that's required. It will come as no surprise to you that during this COVID crisis, there's another crisis that's looming across the United States, and that is the opioid epidemic, which was already bad. Opioid abuse is not going away and has actually surged during the recent COVID crisis. As you know, that's been on the radar again for a long time, and we have a local group called AC Hope that has worked on this since 2017. There have been several large community leadership forums that have been held, and they were already in the process of working on systematically addressing the opioid crisis in Alamance County. Most recent data, according to Ray, Director of EMS, were that from March 1 through June 30th, that's about 4 months, EMS alone administered 83 doses of Narcan, as compared to last year. During that same time period, there were 60. Our officers are dealing with much the same. They are all trained on the use of Narcan and how to administer that and carry that with them at this time. I would again refer you to data from Alamance AC Hope if you need additional information. AC Hope is housed within the health department, the local health department, and they work closely with RHA Crisis as well as EMS and some other county leaders on that. I want to talk now a little bit about our Alamance County Pretrial Supervision Program. We, again, through our grant, had funding to support a 12-month pilot. It was going to be a co-responder program, but when the sheriff came back from San Antonio, Texas, when we took a group of 16 down there, and he decided, I don't want to wait, I want to go ahead now, I want to put some officers on the street to deal just with mental health calls. So after we got those 2 officers in the field on the street handling the mental health calls, we realized we probably didn't need our own co-responder program in the sheriff's office. So we wanted to take that money, that grant money, and do something a little different. So we started meeting with our judiciary and some others, and we formed a committee. And that committee began meeting, I think, as I said, August, September 2018, somewhere there. They helped us develop and frame what that program would look like, what that pilot program would look like, and were very instrumental in getting that started. So Alamance County's been at this for quite some time. The timing was perfect that in January of 2019, last January, we were invited, one of 18 counties across the state, invited to Raleigh to participate in Attorney General Josh Stein's roundtable on pretrial release. So we took, again, a team, and they're listed there, everyone who participated, to Raleigh. And we spent a whole day together, not only hearing from other people across the state about what they were doing in their counties, but we met in the afternoon as a team and sat down and talked about what ours would look like. We came back that very next week and started first appearances for misdemeanor defendants. That was not currently going on in the county. They were having first appearance for felonies at the time, but not misdemeanors. So we again began actively working. I'm going to turn it over to Steve Ginter. Steve is our pretrial release case manager, and he has been employed with the sheriff's office since April of 2019. And so I will let him do this. Do you want me to put it? Okay.
Thank you.
Good morning, Commissioners.
Welcome. Good morning.
Just a brief background about, so I started in April of 2019. The weekend before, I was a probation officer for almost 30 years. And now I'm semi-retired, and thankfully the sheriff has taken me on with this role. It's been a group effort to do this program. It's not just one person doing it. It's the judges, the clerks, the sheriff's staff has been fantastic to work with, the DA's office. It's just really a group effort, everybody putting this together for mental health, low-risk offenders. So I want to go through what the slides say. The first slide talks about the committee, what they feel like this program benefits. It's increased public safety. It's freed up the DA's office to focus on serious offenders. It's reduced the numbers of failures to appear. It's also reducing the recidivism in the criminal justice system. Reduction in involuntary commitments and emergency department visits. This next slide, I will go ahead and tell you there's one correction that should be made. The 75 should be 71. So currently, this is going through those dates, October 1st, 2019. That's when the new software that I've been able to utilize, called C Pretrial Program, which allows me to monitor various things from their success to them making calls. I have them making calls every Wednesday. It also sends them a court date, reminding them when they're supposed to appear. So it's very useful for me to be able to monitor. So as far as the success rate during that period of time, I've had 35 people complete the program, meaning they do whatever the requirements are. Could be going to a mental health provider, getting on the medication, calling me every Wednesday, not getting new charges, just various things with that. There's been 5 terminated cases during that period of time where they did not successfully complete it. And again, I guess it's 31 actually were successful and 35 currently on my caseload, which is sort of increased during this time frame. Mainly simple assaults have increased during this time period, which you guys could probably imagine has occurred. This speaks to, well, it doesn't show the actual names. So going down the very top, failure to appear for larceny, failure to appear for marijuana, failure to appear for driving charge, simple assaults, you can see that's the longest line that has increased. Misdemeanor larcenies, disorderly conduct, communicating threats, violation of the 50B order, which that was done by a judge, possession of marijuana, intoxicated and disruptive, and then just a driving while license revoked charge, carrying a concealed weapon, and break and entering. Those are the kind of offenses that I'm looking at mostly. Sometimes I do get involved with felons, but not very many. The last slide basically goes over the success of the program. If you look, it says 100% maximum for most of it, but the second column says 11. So the first line is for keeping their court date. So it's been almost 100% that they've kept their court date, and I think that's partially due to the software reminding them about their court date. The next one is the average is only almost 2 days in jail. So, and that's partially, I'm able to usually get them in court the same day that I see them. Of course, with it being a weekend, sometimes that adds to that time, but the longest one is 11 days was the maximum. The safety rate, as you see there, is 94.9. That's meaning people have not gotten new charges or received new arrests during the time that they've been under my supervision. The success rate is 81.6%. And that's where they've actually done everything they need to do. Oftentimes they get a dismissal, and that's obviously very useful for them, especially if they have driving charges, because it doesn't go against them. And that's pretty much it in a nutshell.
So what's your current caseload look like?
I have about 35 active cases right now.
That sounds, to me, like a pretty significantly low number. Would I be correct?
I'm part-time right now. I've talked to a lot of people. Some don't qualify for various reasons.
Right.
Some people don't want to be in the program.
And understand, I'm not being critical.
I
I'm just
understand.
saying that sounds like you're managing the number to a very manageable level.
Right.
Which sounds like a positive thing to me.
So I work Monday through Thursday right now.
Now, what day are they in court typically for these cases? Do they have a different court date from?
It does vary. It does vary. Of course, oftentimes they get an attorney. And through this epidemic, those cases have been moved out too.
Sounds good.
Any other questions?
That's great.
Thank you.
I like that safety rate too, 94.9%. That sounds extremely high.
Yeah, thank you for coming today, Steve. I think that this is a really amazing program that I've participated in these committee meetings with the Justice Advisory Council and also the pretrial assessment program, little mini committee.
Right.
And I've just been really impressed by you and your work
Thank you.
and the impact that you've had on the people in the program. I remember was it a Stepping Up Initiative update where we had a young lady came and talked about the impact of the pretrial assessment program on her life, and it was really remarkable how much it meant to her, that she had been in trouble a lot for a long time. And
I can even say that she called me and said she went to the beach for the first time and wasn't high.
Wow.
And it really meant, she sent me pictures of Halloween. She's still connecting with me, and it's really, really helped her out a great deal.
yeah,
That's great.
so this is one of those. This is a program that transforms people's lives, and one of the great things is when we can see the potential in the person in front of us, and then work to help bring out that help them realize that potential within them. And some people need more support. And this is a program that can give that support to people who are really at a very, very low point in their lives. So thank you very much for your work. We really appreciate it.
They have done an outstanding job, believe me.
Yeah, Linda worked so hard. She worked so hard.
Well, I think we ought to note too that the sheriff has commented to me a number of times that he will not retire until this program is fully implemented. I mean, we have a group outside making some comments. If they really understood what he's up to and what he's trying to do in this community, if they really knew and understood, they probably wouldn't be saying what they're saying.
Well, that's why we're here today, is to help make sure that at least they can't say that they didn't have the opportunity to know and understand.
Exactly.
We're giving them the opportunity today.
Thank you. I'm going to be talking to you a little bit about the Alamance County Sheriff's Office, the things that we're trying to do. And certainly, since 1849, we have the same core values that this agency has always had. Unluckily that maybe the finances weren't there to do some of the things back years ago that we're trying to do now. But in the long run, what these two are doing here and what we're trying to put together in this county will save the taxpayers money in the long run. I've made this statement many times before that I run the largest mental health hospital in Alamance County, and that's the Alamance County Jail. And that's why these people, what they're doing is so important, folks. Okay, policy training. Alamance County Sheriff's Office is committed to providing professional law enforcement and detention services. During the year, the Sheriff's Office, by the way of detention staff, processed 8,544 individuals being booked in the Alamance County Detention Center. And you can see they have their hands full because they're looking at everyone that comes in that detention center. These bookings are undoubtedly the same individuals booked multiple times throughout the year on different arrests, but most are unique persons. Alamance County Detention Center has established a number of programs, some which you just heard about a minute ago, addresses and benefits offenders in an attempt to reduce recidivism. Let me tell you something. We have constantly what I call frequent flyers that come to jail, get out of jail, right back in with 2 to 3 days. A lot of these individuals are the mental health individuals that we're talking about. And if we can address those issues on mental health, then they will probably not be coming back in that detention center. Next few slides are just a few examples of initiatives we're trying to do in our detention center. Alamance County Sheriff's Office and Alamance Community College, we got together in 2015 and developed what we call the General Education Development, GED. Any inmate that's in that jail for a period of time that wants to get their GED can do it. The opportunity is there. We partner with the Alamance County Community College to bring this about, and we have had several individuals that go through that have graduated. These classes require inmates to take the GED test. Classes provide valuable education, information regarding all of the 5 main topic areas in the education wing. Math, language arts, was reading, language arts, writing, and social studies and science. Those individuals, and you say, well, Sheriff, why did you want to get a GED program in the jail? Well, let me tell you something. If you were an employer and you had an individual that had gone to jail and done nothing but laid there in jail for a period of time, trying not to improve themselves, or you got an individual that made a mistake, went into the detention center, but then wanted to turn their life around, and they put their efforts in getting their GED. Which one would you hire? The one that did exactly that. And that is so important to give these individuals, I think, an opportunity. And this goes on. All participants first take an assessment test to inform the GED instructors of the areas inmates need to focus on in order to pass the GED test. Once the inmate completes the required classes and successfully passes the GED test, they are presented a diploma for completion and an actual graduation. To see the faces of these individuals that are graduating is unbelievable. The sense of accomplishment is evident on the faces of those who complete the GED program. Oftentimes, This is the first time they have successfully completed an educational course and where someone has showed that they actually care about their accomplishments and success. Think about it. How did you feel when you graduated from high school? Or how did you feel when you graduated from college? And how did those individuals that did not graduate, how do you think they felt? Here's the last graduation. Here's two of the individuals that graduated. And you look at the faces. They're very proud and have a right to be, because they are trying to turn their lives around. Every graduation, we provide them with the cap and gowns and official graduation ceremony. And they're very proud, and when they go out, they have something to look forward to. We also involve the Alcohol Anonymous program. The Alcohol Anonymous classes allow inmates to share their experience, strength, and hope with each other that they may solve their common problem, which is the desire to stop drinking. The primary purpose is to teach individuals to stay sober and help other alcoholics achieve sobriety. This is very important because I would say probably 90% of the individuals in our detention center are either gotten involved with drugs and committed crimes as a result of drugs or alcohol. And so this is very important. The Alamance County Sheriff's Office began the AA program for male inmates in 2015 and for female inmates in 2016. The program addresses the issues of abusing alcohol and provides the support and resources to become sober and be successful and a productive citizen when they are released. So far, 1,932 inmates have participated in the program since 2015. If we can only get 200 of those to stay clean, we have still saved taxpayers money and helped them become successful citizens. Another program we have in there, we work with the Men of Steel, and I know all of y'all heard of Men of Steel. Fantastic program. Men of Steel program is an 8 to 10 week course that is offered to male inmates that have been sentenced or awaiting trial. This program is a religious-based program that helps inmates with their spiritual needs. This program consists of studying the Bible along with a workbook and some occasional homework. Guest speakers often come in to speak with the class, offering testimonies and advice on changing their lives to become productive citizens through religion. Since the program began, 41 inmates have graduated from the Men of Steel. If you have never attended one of the Men of Steel banquets, you need to do that to see how important this program is. And that man has a lot to do with the Men of Steel here in Alamance County. And we appreciate that, Clyde. Change the New Beginnings program. This is Change the New Beginnings program, similar but different program. It was created for inmates to learn and understand the principles of the Bible. The program also provides encouragement to the inmates on how the Bible can help them. This is a new program that has already had 13 inmates graduate. This is where they can read the Bible. Someone can instruct them on how to understand the Bible. And it has helped inmates tremendously. Now, Chaplain Ministry program. Chaplain Ministry expanded in 2015. Chaplain provides spiritual needs to the inmates. Chaplain provides Bibles and approved literature to the inmates. Now, until the coronavirus, the chaplains could come in, visit, and they're going to continue to do that with the inmates on certain time periods that they're allotted. And this is very well received by the inmates, and I think, if nothing else, I believe that we, or I as sheriff, should allow that to happen, or I'm going to be held responsible someday. Alamance County ACT program, headed by community leaders, actively changing together Alamance County, has partnered with Alamance County to offer resources and assistance to incarcerated individuals to prepare them for their re-entry to society. This is a program that was developed by Michael Graves and Reverend Coven, Ebenezer Church, and they have been fantastic to work with. Matter of fact, when even before some of the calls for looking at your policies and procedures, they were already working on that, and we have sat down and I'll go over some of that in just a minute, and really been a great partnership. This Alamance County Sheriff's Office, of course, I'm not going to read all the things, but Alamance County Sheriff's Office currently employs 152 full-time deputies, 18 part-time deputies. These officers are assigned to various divisions within the Sheriff's Office. Listed below are the divisions on the operations side of the Sheriff's Office. Quite a few of them you have. It's patrol. We got 6 districts, including Green Level. We got criminal investigations, see major crimes, frauds, property crimes, special victim unit, domestic violence, which is a big portion of our calls right now. ICAC, internet crime against children, and of course our mental health program that Lyndon and Steve talked about, which has been very, very successful. And you can see on and on. One thing I like to say, specialized investigation, ANET, Alamance County Narcotics Enforcement Team, ATF, we have an officer assigned to alcohol, tobacco, and firearms and explosives. We have officers assigned to Drug Enforcement Administration. We have officers assigned to Federal Bureau of Investigation and U.S. Marshal Service Fugitive Squad. This has been very valuable to the County of Alamance, because what happens in Alamance County don't normally stay in Alamance County, and what happens in these other counties certainly don't stay there. We're having a tremendous problem. Human trafficking and your drugs coming from other counties. Matter of fact, we were approached a couple weeks ago by our U.S. Attorney in Greensburg to possibly become a fiduciary for a strike task force. We're catching people here in Alamance County, some of the small lieutenants in these organizations, because we have put so much pressure with those individuals, including ANET, that they've moved their main headquarters over to adjoining counties, and they have lieutenants set up here that they'll ship stuff to, and they'll move around. We catch that lieutenant, they just write him off and just put another one in place. So the U.S. Attorney wants us to be able to go into the other counties with the other counties and catch and cut the snake's head off. And we're talking about that this time, but nothing has been totally decided on. As you can see, there's other groups in our organization. Our school resource officers, that's going to be very, very important in the near future. With the way things are going in our society right now, we have got to have some work with our officers and our younger generation coming up. Detention. Alamance County Sheriff's Office currently employs 138 full-time detention officers and 7 part-time detention officers. These officers are assigned to various divisions within the Sheriff's Office. Listed below are the divisions on the detention side of the Sheriff's Office. Platoons. You have full platoons, that come in, work 12-hour shifts. So we have special services, we have food services. Of course, that's soon going to change with the new contract, even though we will be involved a little bit that way. We have a medical unit, maintenance, ICE detention, ICE transportation, U.S. Marshal detention, U.S. Marshal transportation, and state inmate transportation. Nobody realizes how many transportation trips we take daily, and some on the weekends with all this. And we travel all over the state, taking state inmates to state correctional centers all the way like Dare County, all over the place. And that's time consuming and also costly. During 2019, the Sheriff's Office recorded the following numbers of training hours for its personnel. I'm very proud of our training division. I can tell you right now, if there's an officer that wants to go to training, any training he wants to go to, and it is a good training, I will send them, I don't care if it's to Egypt, because they will bring back that experience here. And that's why it's so important to try to keep our officers here that we have so effectively trained, rather than having them leave here and go somewhere else. 4,094 hours of state required training for deputies. That's required. 2,530 hours state required training for detention officers. Well, above and beyond all of that, we have added additional 13,137 hours of training beyond that which the state requires. I honestly believe we have one of the best trained organizations in the state and not the country. Altogether, this represents a total of 19,761 hours of job-specific continuing education for employees. And this year, it's been less because of the coronavirus. A lot of the schools that we wanted to send them to, we could not. But as soon as that lifts, we're going to continue. We're going to do a lot of in-house training, but we're going to send officers to the best possible training in the state we can. The following is just a few examples of training that our officers receive. Crisis intervention training, 40 hours. They talked about mental health crisis intervention training. This has been very, very valuable to our officers, but more so to those individuals with the mental health problems. The class prepares the law enforcement professionals to deal better with people in a serious mental health crisis. It is a police-based pre-booking jail diversion program that trains law enforcement professionals to better understand mental illness, de-escalate people in crisis, and direct them to appropriate care rather than to jail. And believe me, that is real important. A partnership between law enforcement and mental health system and consumers, families provides many benefits to the communities. Just think of the families, and I guarantee you, every one of you up here know someone that has mental health problem, a family with someone in there with mental health problem, if not our own, and how important that is. And that's why I am pushing so hard to see this diversion center open up in Alamance County.
So Sheriff, can we pause on that slide for just a second?
Yes, ma'am.
Because from what I've been reading, there's a lot of concern in the greater community about the law enforcement responding to when somebody's having a breakdown of some kind, or you have maybe a special needs young adult who's having a bad day, having a crisis, or maybe you have somebody who is on drugs and not acting appropriately. You can have a lot of different reasons, and there's a big push in the country for the law enforcement to not come out like, okay, I'm just going to arrest you and take you to jail, or using force. That's really, I think, what people are concerned about, is using force to sort of physically restrain that person. And so they're talking about, how can law enforcement respond to people more compassionately and more appropriately. So what I'm hearing from you is this is something you've been working on for quite some time.
Yes, ma'am.
With your training your officers how to respond appropriately to people who are having a crisis.
Yes, ma'am. We train our officers to de-escalate the situation, and that's very important. Also, our officers are trained to know what an individual looks like on certain drugs, etc. Then you'll know what you're dealing with. But it's so important. This crisis intervention training, 100% of my officers are going to be trained in crisis intervention training. I can tell you that, because right now, with our society the way it's going, and with a vast amount of drug problems, and a lot of your individuals that are mentally sick in a lot of ways, they turn to drugs and wind up committing more serious offenses, breaking and enterings, armed robberies, drug sales, etc. And if we can educate our officers, we can help prevent some of those individuals from making it to the jailhouse. Thank you. Okay. Alamance County Sheriff's Office training. In recent years, mandatory in-service training has covered situational awareness. When an officer goes, what is the situation, he is able to better understand. Leadership through community policing. I have preached community policing to our county officers. Now, we're not like a city where we can really go out and get it. But I tell my officers, if you ride, you go in those country stores, you talk to those people, you get to know those people. If you're riding and you see an old farmer with his tractor sitting out on the side of the road, stop talking to that individual. You can build relationships within the community. And those individuals, when there's problems in that community, maybe you can help before it rises to a greater height. You can help bring those individuals down. And that is so important, I think. Strategies to improve law enforcement relationships with minority youth. I'm not here to brag, but I'm going to give you an example. When I first come in office, there was a menace drug problem using 13 and 14-year-old kids to hold the drugs and the money out in the green level area. And before I ran for sheriff, I realized something's got to be done, because you're not catching the older guy, and the kid really don't know what he or she's doing. So through some donors here in Alamance County, we raised over $30-some thousand to start a football program out there, and that was to buy uniforms. We took 2 years in a row these kids, 60-some kids, to the Panthers game. The Panthers gave us free tickets, $20 to each kid to buy, and a lot of those kids, we don't have the problems we have out there now. And that's because we work with the youth, and that's what we've got to do. And it's tough, sort of, a county. If we were in a city, it would be a lot easier in communities. But we are still looking at trying to do everything and bring about new programs to help get those kids to understand we're law enforcement officers, but we love you and we are human beings. Equality in policing, improving decision-making skills, long-term effects of childhood of adversity, and suicide prevention. These are just some of the topics that we've covered. Policy and training, didn't want to touch on this real good. Unfortunate events that have unfolded nationwide have prompted a review of policy and training practices in law enforcement field. We have done that constantly, not just when this stuff happened in our nation. The Alamance County Sheriff's Office took the opportunity to review current policy and training practice with recent concerns in mind. Our latest policy and procedure are always publicly available on our website. Anybody want to see our policies, go on the website. Some specific concerns have been mentioned regarding de-escalation classes and training and more mental health awareness. Currently, our officers complete crisis intervention training and mental health first aid courses. They also receive general de-escalation training on an annual basis. We understand that officers need a firm foundation to be successful. We continuously send officers to job-related training in order to refine their skills. Now, I want to talk about, they were talking about policy. We were presented with 14 things by act, what they would like for us to do. And the other agencies in the county were too. And we have met with some of the other agencies, but I was so proud that of the 14 things they wanted us to look at, 12 of them we were already doing. And I'm gonna go over them right now, saying no chokeholds. We've never advocated chokeholds. We advocate in our policy no chokeholds. Strength or vetting and rehire of any type. Let me tell you something. You get hired by the Alamance County Sheriff's Office, you have undergone one heck of an investigation. And we're the only agency in this county that presents, we have 2 polygraph operators who, after all the investigations done, they have to pass the polygraph. That polygraph is also very important. If you have a complaint on an officer, we thoroughly investigate those complaints. And if necessary, we will give them a polygraph to the officer or request the complainant to take a polygraph. And you'll be surprised sometimes how much, oh no. You know. And I can tell you this, the officer says no, guess what? I no longer need your services. Strenuous review of all complaints, officers, and termination of officer with repeat complaints. We thoroughly investigate every complaint coming into that office. And it's a headache sometimes, but we do. More training. You've seen what we've done with our training aspect. Basic interactive skills training prior to day one. You see, we do it. Citizens Review Board. This is the only thing we don't have as a Citizen Review Board, but we're working with ACT right now to develop that Citizen Review Board. And what I like about it is they, well, look, we just want to know how many complaints you had filed. Did you take action on these complaints? They've looked at it in a very important way, and we're working with them right now to get that done. Police officers should be mandated to intervene and report any infraction or violation of law or police procedures that are committed by any fellow officer, regardless of rank, during execution duty. If I have an officer that does not report an abuse, he won't be an officer for this agency, and I will see that he's not going to be an officer in any other agency in this state. Ensure officers are aware of body camera uses and policy. Right now, we are testing and looking at body cameras. You're looking at probably close to $750,000 for body cameras for all our officers, and the where you have to retain the footage. So that's been the biggest problem. However, we have in-car cameras in every single car that is on patrol that we have. And they have been very valuable in many situations. Revise the no-knock search warrant. Of course, there are certain procedures around the no-knock search warrants that has to be done. Train officers with an emphasis on legal knowledge to prevent violating citizens' rights. Every officer goes through BLET, and if he graduates or she graduates, they better know. And I can tell you, the sheriff's office, with my staff, make sure that our people do what they're supposed to do and do it the right way. Community policing and consistent community interaction. You heard what I had to say. Budget for staff appreciation annual. That's what they said. We're looking at trying to do something to recognize our staff. De-escalation training in volatile situation. You see what we've done. And crisis intervention training. Only two that we really hadn't accomplished is the Citizen Review Board and the in-car cameras. And I can tell you there's plus and minuses on, body cameras, not in-car cameras.
Yeah.
Body cameras, and you say, well, Sheriff, what is the negatives? I can give you an example. A couple years ago, we had the protest down here at the courthouse. There was a squabble. Graham had brand new body cameras. And guess all it showed was the cement on the ground. Cement on the ground. Secondly, officers, they complain, I've heard it, and I agree. If you're going to wear a body camera, if you can turn it on, you turn it on. But officers find themselves in situations sometimes where it's a sudden thing. Maybe I pull him over and you know, just like a routine traffic, and I walk up and he's got a gun. Or we encounter someone just walking down the street. So we're looking at all these situations on the body cameras. And eventually, I think if we can get the money, we'll go to body cameras. But I also want the public to understand that sometimes that officers, it's a split-second decision you have to make. You ain't got to, hold, don't shoot me yet. Let me turn my body camera on. Yeah, sometimes that's not possible. But it gives a lawyer in the courtroom ammunition to get you. So we're real good in that area. Field training. All officers go through an extensive field training program and process before they're released from the field training program. Field training process can last up to 16 weeks depending on the officer's experience level. And sometimes we have had officers go back through it a second time, and if they don't make it then they go home. They don't work for the Alamance County Sheriff's Office. It involves extensive oversight by multiple field training officers and supervisors who must verify and sign off on the trainee's progress. And that is one of a great important program. Head of the local community limits actively changing, and this is basically what I went over here just a minute ago. So I'm not going to spend a lot of time on that, but this is what they wanted us to look at and receive mental health training and a lot of other things. We've only found two that we were not meeting what they said. That's just, I could go on. And we really have a good working relationship with the ACT people. Any questions?
How much did you say it would cost to do the body cameras?
You're probably looking, I'd say, probably five with the storage of the information that's come on. Probably looking at 500. What have y'all looked at, Travis?
I would estimate, like you said, $500,000 to $700,000. It's a massive amount of storage we're going to have to look at, and so we're going to have to get with.
How long do you have to store the video for? Is it a specific time, 30 days, 60 days?
I think
There's a schedule that is attached to what type of video you've recorded. And you can probably consider $1,000 per officer body camera average cost, not just the equipment, but
And I have very limited experience, no experience obviously with body cameras, but having had some recent experience with the video doorbells, very interesting. Those things will store on the cloud, and it transmits from the from the Wi-Fi to the cloud and stores it, and then you can retrieve it. I think to actually undergo the contract per camera, it's like $5 a month. I don't know if anything like that's available through law enforcement or not, but and I mean high quality video too. You can. It was amazing to me how good the video is.
I guess I'm a little confused. A lot of this talk about let's defund police and all that, and you just said what, 500,000 to get a body camera, yet they want to take away money from the police departments. It makes no sense. I'm not a real smart guy, but it doesn't make sense.
Pretty sharp.
I don't understand it.
Can you use civil asset forfeiture money for body cameras?
Yes, ma'am. I'm sure we could.
Do we have any more coming in, asset forfeiture money?
I hope it is. We're seizing it, but
I
I
know.
guess the viruses make them
Gotta
keep all
hold
our
on,
money in
gotta hold
Washington D.C. in case they need it. I've talked to our Congressman Walker about getting them to turn loose of some of that money.
Okay,
Thank
All
you.
right, well, thank you,
Great
Sheriff.
report, guys.
Thank you, sir.
Thank you very much.
excellent report.
I got one question for Linda, or maybe Sheriff.
I'll let you.
Are there beds available in the state now for putting patients when they come in and?
You know, I'm not aware of what the actual number of beds is. I do know that we regularly do transfer people to Central Regional Hospital if we have to, but sometimes they are waiting on beds. I
didn't
do know that.
especially with the COVID
They are in high
stuff
demand.
and, you know,
When
being,
the
everybody's
whole-
scared of everybody and.
Yeah, when the whole county divestiture of local mental health happened,
Right.
and it was, they were closing hospitals. I do know that it's increasingly difficult sometimes to locate a bed, as well as the hospitals often wait on a bed to come open. We would have to look to get that number for you.
That'd be
as far as-
interesting to see. I mean, with
Okay.
this pandemic going on and
Oh,
how,
yeah.
you know, I know it's
Yes.
affected it some.
But we do, in many circumstances, have to, again, transport them to Central Region.
And I do remember there was a day everybody went to the emergency room, and I don't guess you can even take these guys to the emergency room, or?
You can take them to the emergency room, but that is another thing that our, especially when they're not really critically ill, that's another thing that our center would do for us, our diversion center. It would allow us to hold them up to 23 hours or so and get a plan in place so that we would not have to take them to the emergency room.
That's good.
And that kind of thing.
All right, thank you.
All right, how about a recess?
Sounds good.
All right, let's take a 10-minute recess, please.